Well, cataract is basically just the degeneration or the aging of the natural lens
Mm.
in our eyes. So when we're young, the lens in our eyes is crystal clear. So
Mm.
it's sort of like looking through a brand new window. You can
Mm.
see your garden outside quite clear.
Mm.
As you get older, your lens ages and it becomes cloudy.
Mm.
So it's like your window is getting dirty and dirty and dirty. So the effect is you're not getting a clear vision through the window or through your lens anymore. Um, it feels like, something dirty is in your eyes and people try to clean it, but it doesn't go away. That's what they tell me when they come in with cataracts, It's like something's in my eyes, but I can't clean it. Um, and it affects your vision, of course, but it increases your sensitivity to glare, especially when you're driving at night.
Mm.
Um,
Mm.
the headlights on an oncoming car really, really bother you. And sunny days, yeah, you wouldn't be outside very long if you don't have a good pair of sunglasses on. So yeah, that's what cataract is all about.
Mm.
Yes.
So, do you have any advice about how to delay the onset of cataracts? Like you said, it's very like it's related to the aging process.
Mm.
And I've heard some people say that that eventually, we're probably all like they have cataracts, but is there something that you can do to kind of slow down the process?
Yes. And I guess it's go back to that, healthy lifestyle issue that we discussed before with
Mm.
diabetes.
Mm.
So it's a degeneration of the lens, and it's directly related to the degeneration or the aging of your body. So if you have a healthy lifestyle, then the
Mm.
cataract will come on much, much later.
Mm.
The patients that I see that have sort of early cataracts, they're usually related to sort of unhealthy lifestyle, lots of alcohol, lots of smoking,
Mm.
um, neglecting their body, their general health in general. So unfortunately, we still see quite a lot of that.
Mm.
So yeah, healthy lifestyle
Mm.
is the key.
Mm. How about like exposure to UV radiation, like people who are
And yes,
outdoors a lot, are they kind of
that's
more
right. Yes. So
susceptible? And like should they?
it's been confirmed that UV radiation
Yeah.
um, does cause your lens to age a lot
Mm.
quicker.
Mm.
So if you're outdoors a lot, then make sure you wear good eyewear protection,
Mm.
sunglasses with, anti-UV
Mm.
on them. Yes,
Mm. Well, we'll probably talk a little bit more about what good sunglasses are later in this interview. But yeah,
that's
so
right.
you say UV
We see a
protection is
lot of
very
those.
UV protection is very important. Okay, and so what about the cataract surgery process? I mean, just the idea of having surgery on my eyes is not something that I want to think too much about.
Yeah.
But I have heard that it's pretty routine and fairly straightforward. I mean,
That's right. It's
what's your advice on that?
the cataract surgery process is quite a sort of a straightforward operation. So it is an operation. It involves a bit of a incision or a
Mm.
cut
Mm.
on the limbus, or where the color part and the white part of your eye meet. So a bit of a
Mm.
cut.
Mm.
So um, when do people need cataract surgery? Well, basically when it starts affecting the lifestyle. So
Mm.
we discuss with patients about the lifestyle, asking them how the vision is affecting them, um, and also focusing on whether the vision is still um, good enough for driving according to VisionPro standard.
Mm. Mm.
So if someone's vision is below the legal driving limit, then we will have a very serious discussion about getting surgery, because it's first of all dangerous for the patient and the other road users, and is illegal. So they can get in a lot of legal trouble if they don't do something about it. So a lot of time we refer patient for surgery. there are two ways. You can go public or you can go private. Of course, private is much quicker. You can sort of choose your eye specialist who you want to see and who will do the operation on you. Public hospital, the eye and ear hospital, and other affiliated hospital with the eye and ear around the surrounding suburbs do take public patients. There is no cost, but the waiting list is quite long, and you don't get to choose your doctor or your eye specialist. So we tell patient all that, we give them the options, and in the end, it's up to the patients. But the procedure, the cataract surgery procedure is quite a straightforward procedure. Usually you go in the morning, and then by noon you're discharged to go home.
It's with a local anesthetic, is it?
Yeah, it's just a local anesthetic. You don't go to sleep. You're wide awake when the doctor performs the surgery. But yeah, you just don't feel any pain. Maybe
and like how quickly do people notice like improvements in their vision after they have cataract surgery? Is it usually immediate, or is it the next day or next week, or when should they expect to see a difference in their vision?
Usually you go home with an eye patch, and the next day, or usually within the next 2-3 days, you go back to see the doctor to remove the eye patch, and you can probably see maybe 80-90% of perfect vision if your vision is not affected by anything else, and if the surgery went successful. Now I say that because in a very small number of cases, I'm talking about maybe 2-3%, there might be complications with the surgery, but that's very rare. So within the first few days, you'll be able to see quite clearly.
Okay.
You will be given eye drops just to sort of stop any risk of infections, to help the wounds heal quicker. So you'll be on drops for a few weeks, and after 6 weeks, then you're ready to have another eye exam, eye measurement to get new glasses, because your prescription will change completely after your cataract operation.
And do they usually do both eyes at the same time, or do they do one eye at a time? The ophthalmologist, do they operate on one eye at a time?
Yeah, they won't do two eyes in the one surgery. They usually do the worst eye first.
Yeah.
And what I see usually is the other eye, the better eye doesn't need surgery maybe until 1 or 2 years later.
Okay.
In some cases, the patient can see quite well after the first surgery, that they don't really feel like they need a second surgery. But if they want to, they can have it done, after 2-3 months, after 6 months, after a year. It's really up to them. But yeah, it doesn't usually happen at the same time. No.
Okay. Yeah, my father's due to go in for cataract surgery, and his optometrist is telling him that after he has it, he'll be able to see things he hasn't seen in years. So he's probably pretty excited about that.
That's true. I get a lot of comment from patient who just had surgery saying, "My God, I can see like when I was young.
Right.
I see everything very clearly. I can see, hair on my face and stuff like that."
Yeah, it's like getting a new set of eyes again.